My name is Dr. Manwai Lee, and I'm here to talk to you about phaco settings for complex cases today. So we look at customized settings for different scenarios now, because those are the standard settings, and once you've gotten used to them, you start to play around with some of the settings to make sure that your environment is even better as you're dealing with more complex cases. And as we become more accomplished, we start dealing with posterior polar cataracts, perhaps dense brunescent ones, high myopes or posterior vitrectomy and subluxated cataracts is another group of patients that perhaps we want to change the settings so that we get a safer environment and expedite the surgery efficiently as well. So in a posterior polar cataract, you understand what the challenges are is when you have a thin posterior capsule and sometimes an absent posterior capsule. And what you don't want to do is to put fluid into the eye very suddenly and inflate the bag, which may cause a blowout. And that can happen if not during hydrodissection, or is when you first put your phaco probe in and the fluid just comes rushing out and you can just inflate the bag and blow out the capsule, ending up with a dropped nucleus. So the approach really is slow motion. I think it's a term coined by Bobby Osher, but really slow motion phaco is basically just dropping all your settings as low as possible and reducing the infusion pressure, reducing vacuum, and reducing flow rate. So these are, on the left side is the settings that I use for my posterior polar cataract. It's by no means one that you need to completely follow, but it's really an individualized approach based on your technique. But as you can see here, my IOP has been dropped down to 34, and the vacuum, this is for segment removal, is at 350, and my flow rate is down to 32 as well. This is just a quick video showing how stable the environment can be when you operate on a posterior polar cataract as this. I won't run through the whole video, it's just to show that the steps can be carried out quite efficiently, and the anterior chamber is very stable. What I tend to do in posterior polar cataracts, and this one is a relatively soft one, I try to bowl out debulk the nucleus, and we don't hydrodissect, we hydrodelineate, leaving behind the epinucleus to protect that posterior capsule, that thin posterior capsule, and just aspirate things gently. So as you can see here, the anterior chamber is quite stable, and manipulation, there's not much rotation of the lens, but just bring things efficiently with that amount of vacuum is enough to bring the pieces to the tip. And as you see I and A here, I tend to use a bimanual technique to try and crush little pieces into the IA tip. And what you want to do is to leave that posterior capsule plug right to the end. So just to highlight, with these settings, the anterior chamber is extremely stable. Now moving on to a dense cataract, the challenges are different now, because now you have a difficulty with the cracking of the nucleus because the nucleus is so hard. So what you need is very good holding power in order to actually crack the nucleus. So what happens then, you have to bring up your vacuum, increase your ultrasound power, so ensure that you can crack efficiently, and increase your infusion pressure proportionately. And again, these are some of the settings, and this is highlighted with the overlay in the dense cataract here. As you can see, my IOP is about 50, and if the vacuum, you see, as it fluctuates, can move up to about 400 and sometimes more than 400 to get an efficient crack. I don't tend to use longitudinal energy that much. Some people still do. I use torsional, and this goes up to 100%, so I have linear control. So as I step with my foot pedal, the actual in position 3, then the actual ultrasound energy can move up to 100% when I need it to. So as you see, with the efficient balance tip now, with the new balance tip with the Centurion, I hardly ever need to go up to 100%. I think usually about 70–80% really deals with quite a lot of the brunescent cataracts. And once more, just to highlight, with these settings, the anterior chamber is stable. You don't get things flying into your tip unintentionally, particularly the capsule or things like that. And just to highlight the differences between how you change your settings for a dense cataract as opposed to a posterior polar. In the high myopes and post-vitrectomized eyes, you have a different challenge now, because you have a very big eye in a high myope, or no vitreous support in a post-vitrectomized eye, so you end up with very deep anterior chambers, and often you get lens iris diaphragm retropulsion syndrome or reverse pupillary block. So the approach again is not to inflate the eye quickly, because in these eyes, when the pupil, you get a reverse pupillary block, it can cause quite some discomfort to the patient as the iris gets stretched. So the approach is to reduce the infusion pressure and do everything slow-mo as well. There's a very nice feature in the Centurion where they call it the IOP ramp, and particularly for these eyes, it's actually programmed to infuse fluid into the eye in a more gradual manner, so you don't get the sudden column of fluid shooting into the eye and stretching everything and causing pain. So the settings here, as you see, similar to when I was doing the posterior polar, I dropped the IOP right down so you don't get a high amount of fluid going in quickly. And what I've highlighted here is the IOP ramp, which goes up to about 3, which is the maximum. This just means that the fluid is pushed into the eye more gradually. And as you see in the video, you don't get that sudden expansion of the pupil when the reverse pupillary block happens. So this is also a high myope with a relatively dense cataract. So you need to now start balancing. If you have a dense brunescent cataract and a high myope, you need a lower IOP, but you also need a high vacuum for cracking. So the beauty of the Centurion here is the fact that the IOP, or the maintenance of the anterior chamber stability, happens in a program that's actually quite intuitive. It happens automatically. We don't have to think too much about it. What you need to do is to find the sweet spot, and that only comes with using and understanding the machine more. So you see the flow rate here is not too high, despite the fact that this is a dense cataract, and everything is progressing smoothly and the anterior chamber is quite stable. So really, I think this is not that much different from a standard dense cataract. It's just that you wouldn't know that this is in a high myope because the settings have been optimized to allow surgery to proceed as routinely as possible. Now finally, coming to subluxated cataracts, again, different challenges because you have areas of zonolysis, perhaps vitreous in the anterior chamber. Remember, you have to get rid of that first before you actually move on to the surgery. So you don't want to hydrate the vitreous. Again, you don't want fluid to go to the back of the eye, hydrate the vitreous and bring more vitreous forward. And you don't want turbulence in the anterior chamber. So again, the slow motion approach is important. Similar to the posterior polar cataract, you bring all your settings down to start off. And if you need to adjust them intraoperatively, you can. But start off slow. So again, the settings, IOP is dropped down low. And you can see in this case, highlighted on the video, you have a lot of capsular folds highlighting the areas of zonolysis, as you can see in the top part of the video, about 5 to 6 clock hours there. And this is in the sculpt mode. The settings are on the left side with the sculpt mode with a lower IOP, lower aspiration flow rate, and the vacuum just enough to allow good sculpting. So surgery, again, having in this case supported the capsule with the retractors, proceeds quite normally, as in any other case. And again, what you want is this. I mean, the video doesn't show too much different because the settings have been optimized. So just to summarize what I've been going through now so far is really to understand the phaco-dynamics, and it's important to know the interplay between the infusion pressure, the vacuum that you put, and the flow rate and how much ultrasound energy for the different cases. And really understanding this and then knowing how your phaco machine can deliver these parameters are important for us to then customize our own settings. And more importantly is when we approach complex cases, the standard ones are standard, and complex cases, when we start dealing with them, is when these customized settings can really help improve our efficiency and our safety. Thank you very much for your attention.